As COVID cases stretch hospitals to their limits, Advocate Aurora Healthcare is making changes to meet the increasing demand, redeploying staff to cover critical areas and delaying up to half of its non-emergency elective surgeries.
Elective procedures are something that we're watching very closely and scaling down where needed.
A 50% reduction in electives beginning this week in every Aurora facility. Dr. Jeff Barr says the hospitals use a formula to determine which procedures get delayed.
It weights different surgeries and the resources required to conduct such surgeries and procedures.
As non-COVID cases are prioritized in that way, hospital officials are opening new units and sites within the hospitals to care for patients who are COVID positive, so far without any reduction in COVID care.
Certainly we are feeling the challenge, but we are not at capacity. And we have contingency plans to be able to expand capacity.
But hospital officials say that at some point, having to ration services or care to seriously ill COVID patients is something they have had to plan for.
And we pulled in our ethics folks immediately and developed an ethical decision-making guideline. We did not have to use that then, but it is something that we have should that come to be.
All of the planning and prioritizing is not only designed to meet the current demand, but the bigger surge in cases they fear could be just ahead.
If Thanksgiving turns out to be super spreader events, if Christmas turns out to be super spreader events, we're going to see numbers that we couldn't even possibly imagine.
Ken, do the hospitals have enough nurses and staff to keep up with the demand?
Yeah, so far, except it's getting tougher to keep up, Patrick. As we mentioned, they're shifting some personnel to areas where they're more urgently needed. They are aggressively trying to hire more staff. But hospital officials acknowledge today that it's getting more difficult as more of their staff members become exposed to the virus and are unable to work because they're either ill or in quarantine.
Ken Wayne Scott reporting live in Milwaukee tonight. And because of the spike in hospitalization statewide, Children's Wisconsin says it will start accepting adult patients. The hospital will treat adults 26 years old or younger who do not have COVID-19. Children's says it has roughly 300 total beds and enough available to treat adult patients.
So it'll be a day-to-day decision based upon our internal capacity. So we haven't set aside a specific unit or a specific number of beds that we would accept. It's rather based upon the fluidity of what's happening in day-to-day.
Right now, doctors are not treating any adults at Children's, but officials expect that to change in the next week.